The question for us here in the United States, now that it is clearly here in at least 15 or more states and in about 40 countries, is what is it going to be as it competes with a very dominant variant Delta, which we have 99.9% of the isolates in the United States are Delta.
The first thing I think we should say is that we have about 90 to 100,000 cases a day right now in the United States, and 99.9% of them are the Delta variant.
Everything that we need to do for Delta will benefit Omicron, no matter how this variant unfolds. It's not just the emergence of a new variant of concern like Omicron. The big question is whether or not Omicron will outcompete Delta. Remember, Delta is dominant, and that's an extremely dangerous variant.
We know we have, several dozen cases, and we're following them closely, and we are every day hearing about more and more probable cases, so that number is likely to rise. We know it has many mutations, more mutations than prior variants, and many of those mutations have been associated with more transmissible variants, with evasion of some of our therapeutics, and potentially evasion of some of our immunity, and that's what we're watching really carefully.
This one does have the largest number of mutations that we've seen so far, Omicron with about 50 mutations compared to the original Wuhan virus. And it looks as if they probably arose in an immunocompromised individual. This is a hypothesis, but it seems plausible, who wasn't able to completely fight off the virus, and so it remained in the system maybe for months in that person until they finally got over it.
There was literally a list of 8 or 10 mutations that we never wanted to see show up in one variant of concern. And we opened this one up, and all but one of them was there. And the instant feeling was, oh, this isn't going to be good.
We do know that the measures that we take to protect ourselves from the spread of COVID, including wearing masks in indoor spaces, being in well-ventilated spaces, those work will work against Omicron. We also know with vaccines, Chris, that even though we're trying to figure out the exact level of protection our vaccines will give against Omicron, in every case we have seen the vaccinated are better off, and particularly more protected against hospitalization and death.
We don't know whether or not this new strain is inherently less virulent, so it's a more moderate strain of COVID, it's not causing as severe illness, or whether it's presenting that way simply because it's infecting people who already have some pre-existing immunity, so they have some protection from COVID, so they're getting infected, but they're not getting as sick.
What we don't yet know is how transmissible it will be, how well our vaccines will work, whether it will lead to more severe disease.
We do know that people who are infected with the Omicron variant can have mild disease all the way through severe disease. Initial reports suggest that people with Omicron tend to have more mild disease, but it's too early to tell. And the reason for that is because it takes time for people to go through the full course of their infection.
Boosters are going to be really critical in addressing whether or not we're going to be able to handle this.
We know from a vaccine standpoint that the more mutations a single variant has, the more immunity you really need to have in order to combat that variant, which is why right now we're really pushing to get more people vaccinated and more people boosted to really boost that immunity in every single individual.
Our argument is that people around the world who are most at risk need their first and second doses before others get more doses. Many people in the world are protected, very well protected against severe disease and death. And adding another booster on top of that at the expense of others in other countries is what we're saying is unjust, it's unfair, it's not right.